Good afternoon, my name is Erica Rupert. Today I'll be doing the skill of performing a patient suction of patient's tracheostomy. The first thing I'm going to do is clean my hands. I'm going to check the patient's medication administration record and also make sure that I have my supplies and that I have the patient's privacy in mind. So make sure I provide privacy. And I'll go over and I will introduce myself to the patient, explain the procedure to the patient, make sure that I check their allergies, and also check their identification band and make sure it matches up to their, what they say their name and their date of birth to their identification band, and make sure I check for any allergies. And also I'll provide their education, I will evaluate their alteration, make sure there's no cardiac or respiratory concerns. I'll check their blood pressure and vitals. And after that, I'm going to make sure the client's positioned appropriately, make sure the head of the bed is up appropriately, and then I will clean my hands again and put on my non-sterile gloves. And then after I do this, I will make sure that the suction device is set up properly, make sure the tubing is there and set up. And I'll also make sure the patient has appropriate trach suction tubing that they need for their airway. And after that, I will make sure that they have something placed across their chest so nothing gets messed up. And then after that, I will make sure the suction machine is turned on. I think I said that. And after that, I will dispose of these gloves, provide hand hygiene, and then also make sure I check their pulse ox. And then clean my hands again, and then I will make sure that I open my kit. And then after that, I'm going to make sure that I pour 100 milliliters of the solution into the basin. And after that, I'm going to make sure I dispose of those gloves like I did, and then put on my sterile gloves. Move it away from me. And this is my dominant hand. I'll make sure I put those gloves on first. And with my dominant hand, I'll put the other glove, my non-dominant hand. A little tight, but I didn't touch anything. Okay, then make sure I dispose of this. And then after that, I'm going to make sure that I hold my catheter when I take it out. And then with my non-dominant hand, I'm going to hold this end and wrap this up on my dominant hand. And then make sure I connect this to the suction machine. And then after that, I want to make sure that I hold my non-dominant hand into the converting catheter. I put this into the basin, and as I'm pulling down, I make sure that the clinician is going to hyperventilate the patient with this bottle. And then after that, I'm going to make sure that during inspiration, I'm going to put the catheter inside their tube. And as I go down, I don't want to suction yet. I'm going to have my thumb outside. I'm not going to open it up yet. As I put it down, I hit resistance. I'm going to pull it up a tiny bit. And then as they inhale, I'm going to push down on the catheter and suction the patient. Make sure you're twirling it and spinning it as you pull it out. And after that, you want to make sure that the patient's respirations, that their oxygenation's okay. And then after that, you are going to allow the patient to recover for a few minutes. You usually give them 10 to 15 seconds in between. 30 to 60 seconds in between. And you want to evaluate their vital signs. You want to rinse the catheter in between. And if you have to reoxygenate them, you would do it again. And after that, you make sure that you discharge put everything, the tubing all into one. And then since that part is dirty, you want to take it and put it inside your glove. And then cover it up with your other glove. and then dispose of those. And you want to make sure that you turn off the machine, you provide proper hand hygiene, ensure the patient's safety, and make sure the head of the bed is appropriate and that the rails are pulled up. Oh, then you also make sure that you check their vitals and assessment again, and make sure that their oxygenation went back up for their pulse ox.